lot of questions from parents about coughing.
Right.
And there are kids that are coughing for weeks upon weeks.
That's true. Yeah, so kids cough a lot, adults cough a lot, and it's a very common symptom that we see in our practices. So the first thing when a kid starts to cough, it's often an infection. So the first 3 weeks of a cough, it's usually some sort of infection, many of which are mild and will resolve on their own. The next couple weeks of cough are we call post-infectious. A lot of coughs, the kid has been sick and they just cough for another month or so. And we see that from time to time. Those kids don't always need antibiotics, and it's often a viral cough that just sort of tapers off over time. But then we get into a cough that persists beyond 8 weeks, and we call that a chronic cough. So we think of chronic cough as three common causes. The first cause would be something in the sinuses, or something from what we call the upper airway, above the chin. Maybe an allergy causing a nasal drip that's dripping down, or a chronic sinus infection that's causing a drip. Maybe the adenoids are large and there's a lot of mucus dripping down, so an upper airway cough. The second thing we would think is asthma, and some kids just cough with asthma. We don't normally use the term cough variant asthma as much anymore, but that's a term that was thrown around because some kids with asthma, they don't wheeze, they're not short of breath, but they cough. And the third thing is actually acid coming up, or reflux, and often parents will say, well, he doesn't have heartburn, or I don't have heartburn, but not everybody with a cough from acid reflux has heartburn, because the esophagus or the food pipe is very strong. It's meant for acid, but the amount of acid or the strength of the acid that could cause a cough or irritate the throat, much weaker acid could do that. So those are the three causes of chronic cough: something in the sinuses or nose, asthma, or some acid coming up.
So can little babies get sinus infections?
They can. The sinuses are not completely developed in very young babies, but sometimes the adenoids are large, sometimes the area around the adenoids, which is tissue that sits in the very back of the nose that can't be seen without a camera that an ENT doctor would put in there, but sometimes that can get infected and harbor a lot of mucus, and that can drip down and cause a cough.
But it's not typical for young babies.
It's not typical for young
babies
babies to get sinus infections, not very young babies.
Yeah. Sometimes we'll see kids who kind of cough, they seem to get a little bit better, and then they're coughing again. Do you often see that kind of with a cold upon a cold seeming to cause a chronic cough?
We do. Sometimes, you have the kid who's in daycare and they're just getting multiple successive colds. But I'd say if a kid really has a prolonged cough and you think it's coming from something up in the nose or sinuses, it would be nice to have that kid evaluated by an ENT or an otolaryngologist to take a look in there and see if there's anything, dripping down or a lot of thick mucus or pus.
So would you say more than about 8 weeks of coughing?
I would say more than 8 weeks of coughing. Under 8 weeks is, common, infection or after an infection. Of course, you have to take the whole situation into concern.
Of course,
we're talking about just a cough, not cough and fever or a kid who's really sick. We would obviously look into that more quickly.
Yes, of course. It's just sort of saying that it is not unusual for children and adults, but we only see kids here because we're pediatricians, to cough for prolonged periods after a cold, and 3 to 4 weeks is really not uncommon.
That is not uncommon at all. So we don't even use the term chronic cough for coughs under 8 weeks because a lot of those just go away on their own.
Wow, that's awesome.
Yeah, absolutely. Hopefully it will go away.
Most of the time it does.
Most of the time it does, yeah.
Yes, because you're seeing the ones that are going on for a while.
We're seeing the ones that don't, right.
Right, and luckily we see most of the ones that get better.
Thanks so much.
Yeah, thank you.